Hi, I'm Dr. Denise Nuñez. I'm a pediatric intensivist in the Bronx, New York. As you can see, I'm Latina. I was born in Dominican Republic, studied medicine in Dominican Republic, and then came here and did my pediatric residency and a fellowship in critical care. I am a mom of two. I have a husband. I actually have 3 little birds, and I am a businesswoman on top of all that, so you can imagine. So a pediatric critical care physician is a doctor that takes care of pediatric patients that are in the hospital, but they're very, very, very sick. So those are patients that have heart problems, lung problems, that can breathe through their necks, that can eat through their stomach, that in a trauma, in a car accident, very bad asthma attacks. So patients are very, very, very sick. I am the one that takes care of them in the ICU. But in my experience doing the ICU, I actually decided to open a pediatric practice because I saw the need and I saw issues happening in the ICU where our Latino community was having, we're admitted a lot and we're very, very sick because of some issues that were happening, maybe communication issues, maybe, wrong diagnosis, a whole sort of things. So I decided to open a pediatric practice here in the Bronx, where we serve now over 10,000 families, and we take care of the community here in the Bronx. So in serving our communities, our patients in our clinic, I found out a lot of social issues, a lot of issues in my pediatric patients. One of the issues were that I was able to do a study on all my youth and realized that only 25% of my kids were actually graduating from high school, and about 18% were graduating from going into college, which is, very, very low. I wasn't understanding why this was happening, so I actually took a cohort of students, and about 40 students, and spent an entire year with them trying to help them get into college. We were only able to get 12 kids into college, so we actually thought, we did a very bad job. So we looked into all that data again and with our patients in the clinic and realized many issues, but the 3 most important ones, we realized that our parents, Latino parents, don't know how to work the system. They don't even know how the system works at all. Our kids don't have the full support of counselors, people that can guide them through college, throughout the high school system, and also had issues with our kids in the 2nd to 8th graders, where they were really an increment of diagnosis of learning disability, of behavioral issues, of ADHD, of autism. So we found all this in our clinics. So we decided to, where we're actually at, open this foundation and create several programs that would support and help our children in the community. And this all sounds great, right? I mean, I'm a pediatrician, I'm a pediatric intensivist, I have a foundation, I have a clinic, I actually also have an urgent care, which is the first one created as an ICU style. This all sounds great, but it was not easy, and it has not been easy yet. Coming here, being born here, but being a Latina, stereotyped as a Latina, maybe that I wasn't that smart enough to be an intensivist, maybe that why did I not go right away into residency, maybe I just couldn't get into it, or why did I even study in Dominican Republic and I didn't study here, not knowing those are decisions that I could not make. My parents decided to send me to take me back to DR so I would grow there, and with the values that we have as being a Latino community, which is very, very important in my family. And then getting married and decided to take care of my kids. I wanted to be a mother. I knew that the time that as soon as I would start doing into my residency and my fellowship, as it happened, I was 24/7, I was not going to have time to raise my kids. So I wanted to make sure that they were in an age that they could that they had some value already of life, of love, of faith. So the challenges have not been easy. Still, as an intensivist, grown-up woman with businesses, I still have to fight, and I will not stop fighting. So I want to tell my kids, and I want to tell my families and my parents to never give up on their kids, to try to be their friends. It's not an easy time. It's not an easy time for our teenagers. They're going through a lot already. Emotional, personality issues, hormonal issues, and on top of that, all the distractions that they have and all the people on top of them. All the challenges that they face day to day, competitions, right, within each other. So we are that supporting hand. We are the ones that can help them. So I know it's not an easy thing, but we have to try to be their friends. We have to try to understand them. We have to listen to them. We should not criticize them when they're talking to you. Try to be their friends, and slowly we can both work together. So, as I said, I'm Denise Nuñez. I have Tea Time with the Doc, which is a program that's going to start slowly soon. And I would love if you guys can join me, and we'll talk about different topics, about health, behavioral issues, and maybe some social issues too. Thank you. Bye.